The thyroid gland. So recall the thyroid gland is located in your neck. It sits just below your larynx or Adam's apple. This gland produces three hormones. Two of them are very similar. So we're going to basically group these two hormones together. We're not going to get into, the minor differences between the two. There are a little bit of differences in their duration and things like that, but for us, we're just going to keep them as thyroid hormones. One of them is called triiodothyronine because it has three iodine atoms, and then thyroxine has four iodine atoms. So iodine is extremely important for the production of these hormones. We get iodine in our diet. There are sources naturally. And then there's salt. We have added iodine to salt in an effort to make sure everyone gets enough iodine. They use salt because everyone gets a lot of salt in their diet. So if you get a lot of salt in your diet, you're getting plenty of iodine in your diet. So thyroid gland produces T3 and T4 in response to TSH. So remember, TSH is produced by your anterior pituitary. TSH stimulates the thyroid to produce T3 and T4. The main targets for these thyroid hormones are the liver, muscle, bone, the heart, and brain. So it has a pretty wide effect on the body. As I mentioned previously, the number one action to remember is metabolism. So your body needs to be able to adjust metabolism, and that's done using these hormones. Metabolism, kind of by definition, is all the chemical reactions that occur. Some of those reactions are producing energy in the form of ATP, and some of those reactions are utilizing that energy. So for us, we're going to try to keep it as simple as possible. T3 and T4 stimulate metabolism. When metabolism is stimulated, you also need to produce a lot of new proteins. For example, enzymes that drive metabolism. Metabolism requires energy, so we're going to increase energy production. One way would be lipolysis, breaking down fat. Thyroid is very important for body growth, so early development, thyroid hormones are vital. They help develop and grow the body, in particular the nervous system. So if there's a childhood deficiency in thyroid hormones, it can dramatically affect the development of the nervous system. Hypersecretion, we often refer to as hyperthyroidism. One form of that, there's a few different forms of it, is known as Graves' disease. And then you could have hypothyroidism. Again, if it's early in life, it can have very severe effects on development. So here are some disorders. So hyperthyroidism, bulging eyes, sweating, tachycardia, so fast heart rate, nervousness, muscle weakness, nail thickening, diarrhea, and light periods. Those are all signs and symptoms of hyperthyroidism. Hypothyroidism, weight gain, body temperature drops. Bradycardia is a slow heart rate. Depression, brittle nails, constipation, heavy periods. Now, hypothyroidism can be treated with synthetic thyroid hormone. An example is Synthroid. This is levothyroxine, which elevates your thyroid levels. This is a goiter. So goiter is typically due to dietary deficiencies in iodine. So we don't see much goiter in our country because we have iodine added to our salt, but not all countries do that. So if the diet is lacking iodine, that thyroid gland can enlarge in an effort to try to get as much iodine and try to produce as much thyroid hormone as it can, even if it's lacking iodine. Okay, Next hormone, we're still with the thyroid gland, but it's totally different. So we have to keep this one separate from T3 and T4. This one's known as calcitonin. You might remember this one from AMP1. One of the things we cover in AMP1 is calcium homeostasis when we're learning about bones. And the reason is bones can be a reservoir, right? You could get calcium from them, or you can deposit calcium into them. So that's typically why you learn about this hormone back in AMP1. So calcitonin is going to be produced in response to high calcium levels in the bloodstream. So that's the stimulus for the production of this hormone. So if you have high calcium levels, now what might cause that? Well, maybe you're taking supplements, right? If you're taking a calcium supplement and you're really taking large quantities, usually a normal diet shouldn't have too much calcium. So it's typically if you're supplementing, or maybe you're taking an antacid. Some of the antacids that are taken for heartburn have calcium in them. So you could get high calcium by just consuming too much calcium in your diet. And if that's the case, you want to lower it. All right, calcium is an example of homeostasis. You don't want too much of it, and you don't want not enough of it. So if your calcium levels are high, calcitonin's produced, and you can imagine that's going to try to decrease calcium levels. And one way it does that is it targets the osteoclasts. Now we got to go back and kind of revisit what these bone cells do. So the osteoclasts are the ones that break down bone. All right, so this little cell here is dissolving bone tissue, and that's a way to increase calcium levels. So notice that it targets these cells, but it doesn't stimulate them. It's going to inhibit them. So that's why I put this red, blocker here. So we inhibit the osteoclasts so they don't release calcium into the bloodstream. And then in turn, we can kind of deposit more calcium into the bone to bring down calcium levels. Now, you also will have your kidneys kind of excreting calcium. Your kidneys will always be secreting a little calcium unless they're told not to. So we let the kidneys get rid of some of that excess calcium into urine, and that'll also help us lower our blood calcium levels. All right. The next one, so now we're going to move on to a hormone that does the opposite of calcitonin. So we call that an antagonistic hormone, so a hormone that does the opposite, and it's produced by a different gland. So now we're moving into the parathyroid glands. Now we're in kind of the same region of the body in your neck, but embedded inside your thyroid are 4 small parathyroid glands. And these 4 small parathyroid glands produce a hormone called parathyroid hormone. And we want to first think of this hormone as just doing the opposite of calcitonin. So if calcitonin was produced when calcium levels are high and it tries to bring down calcium levels, this hormone is produced when calcium levels are low. So this hormone is going to do things to raise your calcium in the bloodstream. So now we're going to stimulate the osteoclasts, okay, and they're going to chew more of that bone, right? They're going to break down more of that bone and release it into the bloodstream. We're going to tell the kidneys, don't let calcium out. We want to keep it, and we call that calcium reabsorption or retention. So we keep calcium in. Then the third thing, we have to learn calcitriol. Calcitriol is active vitamin D, okay? And vitamin D helps us absorb calcium from our diet, from our intestines, all right? So notice what we're doing. We're breaking down bone, releasing calcium into the blood. We're retaining calcium so we don't lose it into urine. And then we're trying to absorb as much calcium as we can from our small intestines. And all 3 of those things will help us keep that calcium levels up so they don't drop severely low. Calcium is vital. We need calcium for all kinds of things. Usually you think of bones and teeth, but we need it for muscle. So all of the muscle in your body, whether your skeletal muscle, cardiac muscle, smooth muscle, requires calcium. So those muscles are going to feel the effects of low calcium levels. It could even cause heart arrhythmias. Other enzymatic reactions often require calcium. Blood clotting requires calcium, so you might not be able to clot your blood adequately. So we got to make sure that we have enough calcium, but we don't have too much calcium. You'll notice if you overproduce this hormone, you're going to have high calcium levels. If you don't produce enough of it, you're going to have low calcium levels. So you could have hypercalcemia or hypocalcemia. This slide kind of brings those two hormones together. Now, if you had me for AMP1, you might have seen this figure before. I've used it in AMP1. This isn't in your book. It's just another figure I found that really kind of brings both of these hormones together into one slide. How do you read this slide? You start here and just ask yourself, okay, if calcium levels are high, right, that's a stimulus. We need to detect that. So the thyroid is going to detect those high calcium levels and produce calcitonin. Calcitonin goes into the bloodstream, targets bones, all right, inhibits the osteoclasts so we can deposit more calcium, and then just lets the kidneys get rid of calcium. So you don't have to keep it in, just let some out. And that'll bring us back down to normal. If the stimulus is low, we're going to detect that with the parathyroid glands. So there they are, found embedded on the inside of the thyroid. They produce parathyroid hormone, and here are the main targets. Stimulate the osteoclasts so we can release calcium into the blood. Tell the kidneys, increase your uptake or keep that or retain that calcium in the body. Also, produce vitamin D to absorb calcium from our intestines. All right? If these two hormones are working properly, we will maintain calcium homeostasis. And that kind of goal is to be at what's called, 10 milligrams per 100 milliliters of blood. You don't need to go there, but that's kind of what we would call normal calcium levels. All right, this is a classic example of homeostasis. We're trying to maintain some internal condition, blood calcium. We just are doing it with antagonistic hormones. One hormone raising calcium levels, the other one can lower calcium levels. Okay? All right, new gland, the adrenal glands. The adrenal glands are found on top of your kidneys. And they have layers to them. So each layer of the adrenal gland produces a different kind of hormone. So what we do is we just kind of go through the layers. There's basically 4 layers, each layer producing a different hormone. So this gland is like kind of 4 glands rolled into one. Okay? So the outer layer actually has 3 kind of sublayers. I don't get into the sublayers, but the adrenal cortex makes up kind of the outer 3 layers. All right, and then the middle of the adrenal gland is called the medulla. So we're looking at the outer layers here, the cortex. Okay, and the first hormone we're going to learn about is aldosterone. This is another one that I would try to work really hard on because we're going to revisit it. Whenever you see a kidney, you're going to get to it again when we get to the urinary system. This hormone, some people like to call it the salt retaining hormone. That's one of its key functions, is to keep salt in your body so you don't have to keep ingesting salt all day long. You want to keep that salt in the body. When you keep salt in the body, that helps you keep water in the body. Same thing, we don't want water to kind of just go through us. We want to be able to keep that water on the inside. So target kidneys. All right, adrenal glands produce it. All right, then it goes into your blood, circulates throughout the body, but the main target's going to be right back at the kidney. All right, so it doesn't really go from adrenal gland directly to kidney. It goes adrenal gland into the blood, circulates, eventually going to the kidney. I came up with this little drawing to help us. We'll revisit this when we get to kidneys, but basically your kidney is like a barrier, right? It's going to keep certain things in your body by keeping them in your bloodstream. It's going to let other things out of the body by putting them into urine. Okay, so if you're over here, you're going out. If you're over here, you're staying in. And this is what aldosterone does. It keeps sodium in the body. And typically, wherever you move sodium, chloride follows. All right, the opposite charges, they go really well together, right? Sodium, chloride. So you only have to move the sodium, and then chloride kind of just follows. And then remember, water likes to follow salt. So just by keeping salt or sodium in, you will also keep water in the body. And then notice it has the opposite effect on potassium. So it can help you get rid of potassium. All right, we call that secretion or excretion of potassium. So it'll help put more potassium into your urine so you can get rid of it. Now, why would you want to do that? If you have high potassium. All right, so if you have too much potassium, that's just like having too much of anything else. It's no good. So we want to be able to get rid of excess potassium. And that's largely due to diet. So if someone, again, is consuming a supplement, usually when you take a supplement, you're putting too much in your body. Pretty much everything in that supplement, when you ingest it, it's too much for your body. So your body's going to try to get rid of some of that. So your body will produce aldosterone, and you will get rid of some of that potassium. If you overproduce this hormone, you might lose too much potassium. So that's called hypokalemia. All right. So you really don't want to overproduce aldosterone because then you'll have very little potassium, and that's bad for your body. Hyposecretion, there's a name associated with that one. It's known as Addison's disease. Usually with Addison's disease, you get low production of cortisol and aldosterone. Sometimes they go hand in hand. Okay, next hormone is cortisol. Cortisol is also produced by the cortex, the outer layers. Main targets, liver, muscle, and then one important target is your immune system. Okay, so cortisol is often referred to as a stress hormone. So when your body's under a chronic stress, all right, kind of over a long period of time, not an acute stress. An acute stress is kind of like what you would need epinephrine for. If you remember fight or flight, right? Fight or flight's an acute stress, so a very quick emergency situation. That your body's going to produce a lot of epinephrine. Cortisol is produced more when your body's under a chronic stress. And what happens when you're chronically stressed is that can lead to high blood sugar. One effect is gluconeogenesis. So that's a fancy word for making glucose from something else, like a fat or amino acid. So this hormone can produce high blood sugar. It can raise your blood pressure. And then this is a big one I want you to remember. It can suppress and depress your immune system. So inflammation is part of your immune system, and then you can actually depress other parts of your immune responses. All right? And that's one reason why you might get sick a lot easier when you're under a chronic stress. All right? So this can be bad, all right, depressing your immune system. We can also utilize it. So what happened is we learned this, not me, but someone did, that cortisol can suppress inflammation. So what they said was, well, let's make some of this stuff synthetically and use it as an anti-inflammatory. All right, so you might have been on a steroid for inflammation. All right, cortisol is a steroid hormone. So if you've ever taken a steroid for maybe respiratory inflammation, or if you've ever had to have a cortisone shot in, maybe a joint, or maybe you've used cortisone cream or hydrocortisone. These are all kind of derivatives of this cortisol. They're steroids that have anti-inflammatory properties. All right. And they're utilized quite a bit in medicine when someone has either inflammation or if someone has an overactive immune response. So some people with autoimmune diseases, what we want to do is kind of suppress that response because the immune system is attacking yourself. That's what an autoimmune disease is. Your immune system kind of turns on you and starts to attack your nice normal tissue. So one treatment is to put these patients on steroids, and that'll reduce that attack, that autoimmune attack. There is a hypersecretion called Cushing's syndrome, and then the hyposecretion is that Addison's disease. Here's a little bit more about those two disorders. So Cushing's syndrome often results in a redistribution of body fat. They call, the effect on the face moon face. You can get a little kind of hump in the upper back due to the redistribution of adipose tissue. Hyperglycemia, osteoporosis, hypertension, mood swings. So this is all high cortisol. You can also develop this kind of Cushing syndrome if you take large amounts of steroid anti-inflammatories. Addison's disease can result in low sodium levels, weight loss, dehydration, hypotension. So this was high cortisol. This is low cortisol and aldosterone. And the reason why I have JFK here is he had Addison's disease. One interesting symptom of Addison's disease is a craving for salt. So because the aldosterone is low, your body loses salt. So as a response, your body kind of craves more salt. Okay, so that was cortisol. We're still at the adrenal glands. We're still at kind of the outer layer of the adrenal gland, the cortex. It produces some hormones we collectively kind of call androgens. Androgens are kind of precursor sex hormones, so they can be converted into testosterone, estrogen, especially after menopause when a woman's ovaries are no longer producing much estrogen. The woman can get some estrogen from these androgens produced by the adrenal glands. They're involved in initiating puberty. They're involved in sexual characteristics and sex drive. Not going to focus too much on these. Basically, for this, I would make sure I know that these androgens are produced by the adrenal glands and they are kind of precursor sex hormones. Finally, on the inside of the adrenal gland, kind of buried in the center, kind of the core of the adrenal glands, is known as the medulla. And you've probably heard of this back in A&P1 when we talked about the sympathetic nervous system. So the sympathetic nervous system is the subdivision of the autonomic nervous system that we often refer to as fight or flight. All right, so when your body is in some sort of fight or flight or emergency situation or embarrassment or excitement or exercise, we often call those the E situations. So emergency, excitement, embarrassment, energy. Your body produces epinephrine and norepinephrine, okay? And epinephrine and norepinephrine are going to do all the things that your sympathetic nervous system does. It just does it by using hormones. So main targets, liver. So what's the liver going to do? It's going to help increase your blood sugar, all right? So it's going to release stored up glucose and release that into the bloodstream. It's going to open up your airways. So it causes bronchodilation or dilation of the bronchioles, the airways. Your pupils are going to dilate. so you can kind of see more of your environment. Your heart rate goes up. Epinephrine and norepinephrine boost your heart rate. It increases your blood pressure. And then it'll turn down things you don't need, right? When you're in an emergency situation, you don't need your stomach digesting food. So it'll actually inhibit your stomach and other parts of your digestive system. There is some forms of hyper and hyposecretion. One cause of hypersecretion can be a tumor. Again, sometimes if you have a tumor in a gland, it'll overproduce whatever hormone that gland produces. And then we can use epinephrine as a treatment. So you might have heard of an EpiPen. So an EpiPen is used for severe anaphylaxis or allergic reactions. Now, what would an EpiPen do? What we're going for is this effect. We're going for opening up the airways. Sometimes when someone is experiencing an allergic reaction, their little airways constrict and they have a hard time getting air down into the lungs. So this epinephrine can be a very fast way to open up those airways. Okay? So that's the adrenal glands, epinephrine and norepinephrine. I think we'll stop there. We might as well start a new video where we focus primarily on the pancreas, and then we'll kind of wrap things up in this last video.